All right, everybody, welcome back for another deep dive.
Yeah.
This time we're going to be looking at an interaction between a nurse and a patient.
Okay.
And specifically, we're going to be looking at this patient who's dealing with high blood pressure and chest pain.
Interesting combination. Yeah.
Yeah.
For sure.
And you know, this is a role play scenario.
Okay.
But you know, I think it can give us some insights into, you know, how to talk to patients, or even just for our own, you know, knowledge about, you know, if we're experiencing these things, how healthcare providers approach, you know, patient care.
Right. And I mean, the communication is huge. I mean, if you don't feel comfortable with your provider, you know,
Absolutely.
you're not going to be as open and honest with them.
Absolutely. And how they communicate can really affect your you know, mental state when you're going through something like this.
Oh, for sure. Yeah.
So, well, let's jump right in. The patient's name is Mr. Smith. He's 55 years old.
Okay.
And he's experiencing these two things, high blood pressure and chest pain.
Oh. Double whammy.
Yeah, so how does the nurse first approach that anxiety?
Well, right away, the nurse acknowledges Mr. Smith's anxiety.
Okay.
She says, you know, it's perfectly normal to feel anxious when you're, you know, having chest pain and you know you're worried about what's going on because you know it's scary.
Yeah.
You know, you don't know what's going on. And I think that's one of the biggest things about, you know, you go to the doctor and you don't know
Right.
what's happening. You don't know what's going to happen. It's really scary. And so I think that, you know, being able to address that right away and say, hey, this is normal, you know,
Yeah.
let's talk about what's going on. Let's figure this out, you know.
Right.
I think that just starts building that good connection in that relationship.
Yeah, and I you know, as someone who's, you know, been on the patient side of that equation,
Yeah.
having that acknowledgement from the provider, I think really does make a difference.
Oh, yeah.
You know, just that feeling like they understand where you're coming from.
Yeah.
So that's great that they do that right off the bat. So then how does the nurse explain the potential link between the high blood pressure and the chest pain?
Well, she kind of starts by talking about, you know, what high blood pressure is
Okay.
and how it can affect the heart.
Right.
You know, she kind of describes it as like, you know, your heart is like a pump.
Oh.
And it's pumping all the blood through your body.
Mm-hmm.
But if you have high blood pressure, it's like there's more resistance in the pipes.
Okay.
So your heart has to work harder
Oh, I see.
to pump the blood through. And that extra work can strain the heart.
Okay.
And that strain can sometimes lead to chest pain.
Got it. Okay, so it's not necessarily that there's something wrong with the heart itself.
Right.
It's just that it's working overtime.
It's working harder than it should be. Yeah.
Yeah. Okay. So, and then the nurse also emphasizes that catching high blood pressure early is good.
Right.
So what does that mean, like in practical terms?
Well, it means that Mr. Smith can start taking steps to manage his blood pressure now
Yeah.
and potentially prevent like more serious problems down the road.
So what kind of problems are we talking about here?
Well, high blood pressure, if it's not managed, it can lead to all sorts of things like heart attacks, stroke, kidney damage, vision problems, you know.
Oh, wow.
It's a serious condition if it's left untreated.
Okay. Yeah. So
Sure.
so catching it early and starting to manage it right away
Exactly.
is really important.
Yeah. And that's why they say it's a good thing that they caught it early,
Okay.
because now he can start, you know, taking steps to manage it.
So what are those steps? What kind of treatment plan does the nurse recommend?
Well, she recommends a 3-pronged approach,
Okay.
which involves medication, dietary changes, and exercise.
Okay, so it's not just one thing. It's like a combination of things.
Exactly. It's a holistic approach. You know,
Right, got it.
It's not just popping a pill and calling it a day.
Right.
It's about making lifestyle changes as well.
Okay, so let's break those down one by one. So starting with medication.
Oh.
What kind of medication would typically be prescribed for high blood pressure?
Well, there are a lot of different types of medications that can be used.
Okay.
And it really depends on the individual patient and their specific needs.
Okay.
But some common types include things like ACE inhibitors, ARBs, beta blockers, calcium channel blockers, and diuretics.
Okay, and so how do those work, like in layman's terms?
So I'll give you an example of ACE inhibitors.
Okay.
ACE inhibitors, they basically help relax your blood vessels,
Okay,
which makes it easier for your heart to pump blood.
got it.
So that lowers your blood pressure.
Okay.
ARBs, they work in a similar way. They also help relax the blood vessels.
Mm-hmm.
Beta blockers, they work by slowing down your heart rate and reducing the force of your heart's contractions,
Okay.
which again lowers your blood pressure.
Got it.
Calcium channel blockers, they relax the muscles in your blood vessels. And diuretics, They help your body get rid of excess salt and water,
I see.
which can also help lower blood pressure.
Okay, so those are just some examples. And obviously, if you're prescribed medication, you should always talk to your doctor
Absolutely.
about what it is and how it works.
Yeah. You should never just take medication without understanding,
Right.
what it is and what it's for.
Exactly. Okay, so moving on to dietary changes. What kind of advice does the nurse give Mr. Smith about his diet?
She tells him that one of the most important things he can do is to reduce his salt intake.
Okay.
Because salt can actually contribute to high blood pressure.
Got it.
She also recommends increasing his intake of fruits and vegetables,
Oh.
which are naturally low in sodium and high in potassium,
Mm-hmm.
which can help lower blood pressure.
So it's like a 1-2 punch. Reduce the bad stuff,
That's
increase the good stuff.
Exactly. Yeah, and she also, kind of explains to him, like, why these things are important.
Okay.
Like, she talks about how salt can attract water. Yeah.
And so if you eat a lot of salt, it can actually increase the volume of blood in your bloodstream,
Oh, I see.
which puts more pressure on your arteries.
So it's like literally adding more liquid into the pipes.
Exactly.
Which makes it harder for the heart to pump.
Exactly.
Okay.
And then she talks about how fruits and vegetables are rich in antioxidants and other nutrients
Mm-hmm.
that can help protect your heart and blood vessels from damage.
Got it. Okay, so those are some really specific dietary changes that he can make.
Right.
And then what about exercise? What does the nurse recommend in terms of exercise?
She recommends that he try to get at least 30 minutes of moderate intensity exercise most days of the week.
Okay.
And she specifically suggests walking
Okay.
because it's a low impact activity
Right.
that's easy to do and doesn't require any special equipment.
So you don't have to go join a gym or anything. You can
Exactly.
just go for a walk around the neighborhood.
Right.
Okay, so that's pretty manageable. Yeah, and she also emphasizes that, even small amounts of exercise can make a difference.
Okay.
So if he can't do 30 minutes all at once, he can break it up into shorter intervals throughout the day.
Got it. So like 3 10-minute walks
Exactly.
would be just as good as one 30-minute walk.
Exactly.
Yeah.
And she also, kind of talks about how exercise can help strengthen your heart and improve your circulation,
Right.
which can help lower your blood pressure.
Got it. Okay, so far we've got medication, dietary changes, and exercise.
Right.
What about the prospect of being on medication long term?
Yeah.
Because I think that's something that a lot of people are concerned about. It's like, do I have to take medication for the rest of my life?
Right.
How does the nurse address that?
She's very honest with him, and she explains that the duration of medication really depends on the individual patient and their response to treatment. Some people might need to take medication long term, while others might be able to reduce or even stop their medication with lifestyle changes
Okay.
and careful monitoring.
So it's not like a one-size-fits-all kind of thing.
Exactly.
That's very personalized.
Right.
Okay.
And she also emphasizes the importance of close monitoring,
Okay.
making sure that his blood pressure is under control
Yeah.
and making adjustments to his medication if needed.
So like regular checkups
Exactly. Yeah.
and blood pressure readings and things like that.
Right.
Okay. So far we've talked about the high blood pressure.
Right.
Let's move on to the chest pain, because I think that's a
Yeah.
really scary symptom for a lot of people.
Absolutely. I mean, chest pain is never something to take lightly.
Right.
It can be a sign of a serious problem,
Yeah.
so it's important to get it checked out by a doctor.
So how does the nurse approach this?
Well, she reassures Mr. Smith that they're taking his chest pain very seriously.
Okay.
And she tells him that, the good news is that his tests have ruled out a heart attack.
Okay. Well, that's good news.
That's a big relief.
Yeah.
But she also emphasizes that it's still important to be aware of any warning signs
Okay.
and to report them to his doctor immediately.
So what are some of those warning signs that he should be looking out for?
Well, she tells him to watch out for things like severe pain that doesn't go away,
Mm-hmm.
shortness of breath, dizziness, nausea, sweating,
Okay.
any kind of new or worsening symptoms.
Got it. Okay. So it's not just about the chest pain itself.
Right.
It's about any other symptoms that might accompany it.
Exactly.
Right.
And, she really stresses that if he experiences any of these warning signs,
Mm-hmm.
he should call 911 or go to the emergency room right away.
Okay. So better safe than sorry.
Exactly.
Okay. So the tests have ruled out a heart attack.
Right.
But what are some other potential causes of chest pain?
Well, chest pain can have a variety of causes.
Okay.
Some of them are related to the heart. like angina, which is a condition where the heart isn't getting enough oxygen. But chest pain can also be caused by problems with the lungs, muscles, digestive system, even psychological factors like stress and anxiety.
Wow. So it could be a lot of different things.
Yeah, it's a really diverse range of potential causes.
Okay, so how do they figure out what's causing it?
Well, it involves a lot of detective work.
Okay.
They have to take a detailed medical history, do a physical exam, and often run some tests.
Okay.
Like an EKG, a chest x-ray, blood tests, things like that.
Got it. Okay, so it's a process of elimination.
Exactly.
Okay, so now I want to talk about stress.
Yes.
Because I think that's something that we often overlook.
Yeah.
But it can have a real impact on our physical health.
Absolutely.
How does the nurse address stress in this scenario?
Well, she brings it up with Mr. Smith, and she explains that stress can actually contribute to high blood pressure.
Okay.
When we're stressed, our bodies release hormones like adrenaline and cortisol, which can temporarily raise our blood pressure. But if we're constantly stressed, those hormones can stay elevated, which can lead to long-term high blood pressure.
So it's like the fight or flight response is being triggered all the time.
Exactly. Yeah.
Okay, so what kind of advice does the nurse give him for managing stress?
Well, she suggests a few different things.
Okay.
She talks about the importance of relaxation techniques, like deep breathing exercises, mindfulness, meditation, yoga, things like that.
So finding ways to kind of calm the nervous system down.
Exactly.
Okay, and what are some specific examples of relaxation techniques that you might recommend?
Well, she mentions the 4, 7, and 8 breathing exercise.
Okay.
Which is a really simple technique where you inhale for a count of 4, hold your breath for a count of 7, and then exhale for a count of 8.
I see.
And she says you can do that a few times whenever you're feeling stressed.
Okay, and that can help kind of reset the nervous system.
Exactly.
Okay.
She also suggests things like mindfulness meditation, which can help you focus on the present moment. Right.
And let go of anxious thoughts.
Okay.
And she also mentions things like yoga and Tai Chi, which can help to relax the body and mind.
Got it. Okay, so those are all really good tips for managing stress.
Yeah, and she really emphasizes that, even a few minutes of relaxation each day can make a big difference.
Okay.
It's not about spending hours and hours.
Right.
It's just about finding a few minutes here and there to de-stress.
Right, and making it a habit.
Exactly.
Okay, so as we kind of wrap up this deep dive, I really like how the nurse ends the conversation with Mr. Smith.
Yeah.
By reassuring him that he's in good hands.
Right.
And I think that's a really important message for patients to hear.
I think that's huge.
When you're feeling anxious and scared, it's really reassuring to know that, your healthcare provider is there for you and is going to take care of you.
Exactly. I think, you're putting a lot of trust in your provider.
Right. And you're hoping that they have the best intentions for you. And so when they reassure you like that, it can really, calm your nerves and
absolutely,
help you feel like you're in good hands.
So this has been a really interesting deep dive.
Yeah.
I think we've learned a lot about high blood pressure, chest pain.
Absolutely.
And how to communicate effectively with patients.
Yeah. I think, we've touched on a lot of different aspects of these conditions.
Yeah. And as you go about your day,
I
want you to think about this.
Okay.
If you were in Mr. Smith's shoes, what would you want to know from your healthcare provider?
That's a great question.
What additional questions would you have or what concerns would you want to address?
Yeah, I think it's really important to be an active participant in your own healthcare.
Absolutely.
You shouldn't be afraid to ask questions and advocate for yourself.
Exactly. So that's all the time we have for this deep dive, but we hope you found it informative, and we'll see you next time.
Sounds good.